Hello and welcome to another in our series of Pods Heal Heals 2020 videos. And we talked a little bit about the potential diagnosis and causes of heel pain and specifically plantar fasciitis. But what happens when you have been diagnosed with plantar fasciitis? What can you do to treat it? Well, there is a regime of treatment protocols. As I've discussed previously, there tends to be no one specific cause for developing plantar fasciitis or plantar heel pain. It tends to be a multifactorial, and so we often have to hit it from multiple angles. And we start off with the simple things: stretching. That can be stretching the calf muscles, the hamstrings, and the plantar fascia itself, and massaging the plantar fascia. And that can help for a lot of people, especially if they have very tight calf muscles and hamstrings. It allows better range of movement through the ankle, and it allows better gait, and hopefully reduces the stress on the plantar fascia. Strengthening is another one. And with stretching and strengthening, we do find that sometimes people go a little bit too hard too soon. What you really need is advice from your podiatrist on how to build up these stretching and strengthening exercises. But with strengthening, what we want you to do is strengthen the calf muscles, that's the gastrocnemius, and the soleus, which is the one that sits under that big bulky calf muscle. And we also want you strengthening your intrinsic foot muscles, so those little small muscles in your feet that actually help your feet function as well as possible. We will often, as podiatrists, give orthoses or insoles for your shoe just to help get you over that initial period. I don't like to give them long term unless there is a necessary reason. For things like plantar fasciitis, I tend to give them as part of a treatment plan along with everything else, and so people can progress out of those orthoses if at all possible. Footwear advice is really, really important. You can't heal plantar fasciitis if people are going to be continuing to wear the inappropriate footwear that caused it in the first place. And lifestyle changes. If being overweight is one of the causative factors, losing weight is going to help with that. Now, going into other more expansive treatments, there are things like shockwave therapy, laser therapy, steroid injections, and even surgery that you can get for plantar fasciitis. Usually those are very chronic cases or actually misdiagnosed cases, although shockwave therapy can be very, very useful in plantar fasciitis cases. So I try and progress people through a treatment plan, and hopefully we can get them over, especially in the acute phases, we can get people over this plantar fasciitis flare up without going into really extreme treatments. But it is essential that you get that diagnosis. These treatment plans will not work for all heel pain cases. If it is something other than plantar fasciitis, you'll probably need a different treatment plan. So diagnosis is essential. If you're suffering from heel pain, see a podiatrist, get diagnosed, get a treatment plan. Even if that isn't with that podiatrist, they should be able to point you in the right direction to get you the help you need. Any questions, comments? Pop them underneath this video or send me a message directly and I'll get back to you.